But I was afraid of using exactly what you say.
Exactly.
You cannot put a 3.5 because you know you'll have distal dissection. So I put a 2.75, and then we superinflated that proximally, put a 3.5 in the proximal already. So, I mean, whether you use IVUS for sizing or not, we don't do that routinely, but that's ideal.
Yeah.
I mean, I'm not a big advocate of IVUS as well. However, if I have a long lesion like this, complex lesion like this, I would use IVUS for making sure that the stent has been well expanded when you have heavily calcified like this. At the end of stenting, not for the sizing purposes, I would use that just to make sure that the stent has been well expanded, especially if I'm going to be using drug-eluting stent in a calcified with a patient with the renal impairment, because risk of thrombosis is much higher.
Yeah.
In a situation
But
like
this is the difference between the adequate position of the stent, deployment on the vessel, and the fact to reach the real diameter of the vessel. It's totally different. You can have a stent totally well opposed to the vessel wall, but a little bit undersized to the vessel diameter. And that's, it depends on the residual narrowing, the residual pack burden you leave.
The stent
I fully
thrombosis
agree.
is depending on the adequate positions, not the sizing.
Yeah,
So that's what this is the important question.
absolutely.
To be sure that we can safely advance 2 long stents.
And then I guess, although Didier will tell me how he usually takes an over-the-wire balloon off a short wire, but we can discuss that in one moment.
Okay.
Didier, to explain the microcatheter, it consists of a very short monorail part.
In fact, everything is it's a over-the-wire device, so you can exchange very long wires. It's very useful for long wires as the rota wire, and you can place inside another floppy or dedicated wire. We used a standard length wire here, and we'll have to use another technique with saline, only saline. That's it.
Yeah?
So there are 3 techniques to withdraw safely a microcatheter when you have used a standard length wire. The first one is to, as Martin is going to perform, is to use the inflator with saline or contrast dye, and to go to, can you go to 14 atmosphere? And we can see that normally the guide wire is able to stay at the distal part of the artery, while the catheter is getting out very nicely. The second technique is to use an extension to have a 300 centimeter wire, and the last one is the trapping balloon technique, which can be quite difficult with 6 French, but you can place, not necessarily with a wire before, place a balloon which has the diameter of the inner diameter of the catheter, just in the distal portion of the catheter to trap your wire while you're retrieving the catheter, the microcatheter.
So which stent have we gone for here, Didier? It's a
Can you comment
275
on this
by
again?
24.
Can you comment on this again?
Yes,
for the
it's
microcatheters?
a way, it explains how to withdraw the catheter inside the microcatheter on the wire when you have a normal length and not a long wire. You have the possibility to do what you have done. You place your deflator on the, first of all, we remove the catheter till you lose the wire in the lumen, in the inner lumen. Then you connect your deflator, you place 14 atmospheres, and you pull your catheter, and the wire with the pressure of the deflator remain in the distality, and that doesn't move. This is the first solution. The second solution is to use the same thing with the pressure, but with the syringe. But you have to force. It's better with an deflator. The other the possibility is to place a wire extension, what he said, but the problem then we have to deal with a long wire. The third possibility is to place the balloon and close fix the wire with the balloon, but I dislike that. But the best solution, the easiest is this. You place in deflator, 14 atmosphere, you withdraw your catheter, and the wire is still in place. No. It's just a counter pressure to maintain the wire in distality. I think we can move because time is moving.